I'm Dr. Pradip Ganguly speaking from Bolpur. I'm a consultant physician. I'll be speaking about GERD today. The gastroesophageal reflux disease or GERD is more frequent in older adults, but the diagnosis and the treating it may be difficult, can be difficult because the symptoms in the older adults may differ from those in younger patients, making it very important to pay attention to changes. GERD can be harder to diagnose in older patients. They might not experience the classic symptoms like heartburn, chest pain, or bloating over the upper abdomen. Instead, they may have more likely to have a feeling of food coming up, difficulty in swallowing, general stomach discomfort or indigestion, occasionally nausea and vomiting, and sometimes chest pain that is not related to heart. Older patients are more likely to experience complications like ulcers, bleeding from GERD, particularly lower esophageal bleeding due to erosive esophagitis, which can make the condition more serious. It is important to recognize these symptoms early to for the proper diagnosis and proper treatment. Symptoms of GERD in olders can be confusing as they may resemble those of other conditions such as heart issues, infections, or certain digestive disorders. So, many older patients have multiple health conditions that can mask GERD symptoms. Additionally, changes in the nervous system lead to unusual symptoms, or patients might dismiss their discomfort or normal dietary issues. So, even if these symptoms seem vague, maybe on the lookout for signs like chronic cough due to high regurgitation because the regurgitated fluid enters into the respiratory tract, which could indicate GERD. So, proper diagnosis is essential to manage GERD effectively, especially in the older people, older adults. If you experience the symptoms, it is important to talk to your healthcare provider. So, GERD does not go away on its own and usually needs long term treatment. So, approaches include the lifestyle changes, number one. Number second is medication and anti reflux therapy with medicine or surgery in some cases. So, what are the lifestyle changes that control the GERD? That's number one, shedding some extra kilos. So, weight reduction is important, particularly for the obese patient. Elevate your head while sleeping, particularly, and while sleeping, you should keep a left lateral decubitus up because at that position, the stomach becomes dependent and it is so left lateral decubitus is a preferable position and it prevents certain regurgitation because usually the left lateral decubitus position the stomach lies low. Not wearing tight clothing and quit smoking and also quit alcohol. Limit proportion of size of food because eating small meals and avoid eating late in night. So small meals frequently is beneficial instead of large food because if the stomach is full of food, the regurgitation can occur easily. Avoid certain trigger foods which can worsen the reflux, such as citrus fruit, fat-rich foods, chocolates, onions, garlics, etc., and etc., because they actually causes stasis in the stomach, delay in the empty of the stomach. So long the food will be in the stomach, there is a chance of regurgitation. And one should be cautious with certain medicine that can make it a point. It is a point to talk to your doctor about the medicines you take Take antacids while consulting your doctor. Certain medicines, particularly calcium channel blockers and certain other medicines, can relax the lower esophageal sphincters. So these medicines to be avoided. Proton pump inhibitors are medications which are effectively in managing symptoms of GERD, and along with that, you can add certain prokinetics to prevent the regurgitation. And last of all, the surgery may be an option for the older patients who, number one, have a very low resting pressure in the lower esophageal sphincter. Secondly, do not respond to available medicines and have complaints from severe GRD. Overall, these options can help you to manage your symptoms and improve your quality of life. So, in nutshell, this is about the GRD, and particularly we should take care for the older patients because their complaints may be confusing, their perception may be confusing, and their treatment. Atypical symptoms of GRD may occur in the old elderly patient. So we have to very cautious and we have to very watchful to see GRD patients, particularly for the elderly patients. Thank you all for kind listening. Thank you.